Commissioner Tanner, we are here today to celebrate a milestone, 1 year since Governor Kemp appointed you to be Commissioner at DBHDD. It's been an exciting year, and I know a busy year. I want to ask you, before we get into policy and all of that, from a personal perspective, what's this year been like for you?
Well, it's been a whirlwind, Jeff. It wasn't. It was what I expected and not what I expected in a lot of ways. Having been around state government pretty much for the last couple of decades, I have worked with some tremendous state employees. I've saw their work, but it's always been from the outside, whether it was working with them from a county government perspective or whether it was working with them from being a state legislator perspective. But having been the commissioner for the last year and having been able to really travel the state and personally meet with state employees, get to understand what they do every day, get to know them, get to know the leadership here in the department, I think I've just been surprised at just what a tremendous team we have here at DBHDD. I knew they were good, and I knew that we had some great people working here for the state. But I did not realize the level of commitment and how deep that commitment goes throughout this department. So it's really been inspiring over the last 12 months.
And let's talk about the team. It's about 4,500 strong, statewide team, working 7 days a week around the clock. Many of those team members on the front lines, working in direct care in some of the most emotional and serious medical situations. Now, you've quickly gotten the image of a person that travels around the state, that gets out of Atlanta, gets out of the Twin Towers. So as you've traveled, you've met a lot of state employees. Tell us a couple of observations you've made that you didn't know before you did these travels.
Well, one of the things that I set out to do early on was to improve the image of DBHDD. We formed a work group early on looking at the workforce and the workforce challenges that we have. And I was really struck by an employee from our hospital in Savannah who was involved in this work group. And they said, Google our hospital, and the only things that people put out are negative. And if someone's wanting to come to work here, why would they? Because they're only hearing the bad things. So I set out to change that image, and by being able to tell the stories of a lot of our employees. So I think it has struck me that the people of DBHDD are just quiet soldiers and quiet heroes that are working. They're not looking for fame. They're not looking for public admiration. They're just quietly being heroes each and every day across our state. And I said it before, but it's really inspired me to be their biggest cheerleader. And, the reason I've gotten out of Atlanta so much is you hit on it. We have over 4,500 employees in this department, and almost all of them work outside of this building. And it's important to me to go to Savannah and to Columbus and to Milledgeville and to Augusta and to our hospital here in the Atlanta area to meet people where they are.
We've had the privilege to accompany you on a couple of tours, and all of our 5 hospitals are special places. But there's there's some innovative programs going on at a couple of those. Tell us a little bit about some of the innovation that's already occurred this past year.
Yeah, we've got some folks that work in our system in the hospitals who really are cutting edge in their fields and come up, give them a problem, and they'll create a solution. One example of that is down at our hospital in Savannah. When I was there visiting, we were talking about people who have been in the hospital setting for a long period of time that the hospital believes could be clinically ready to be released, but they may be there for court-related reasons, forensic reasons. And we talked about creating a place to do a step down, a transition program. So they're currently underway doing renovations on 30 beds. They named it. It's called Operation New Hope. Operation New Hope is going to be the state's first transitional facility in a state mental health hospital, where we're going to be able to teach vocational skills, life skills, all the things that someone needs to be successful in the outside world. And then from there, we're going to be able to help that person get a job go to work during the day, come back to the hospital at night, and eventually be able to work out of the hospital setting into the community. And that's pretty inspiring. And then I think about what's happening over at Central State. We have a backlog of forensic cases in the court system. So we've been looking at a Dodge County facility that's no longer being used. It was a DJJ facility to create a jail-based restoration program there in partnership with the sheriff in Dodge County. But the challenge and the roadblock that we kept coming up with was, how are we going to clinically staff this facility? And Gil Sutton, the hospital administrator in Central State, which is the closest hospital there, he said, "Commissioner, give it to me. I can do it." And he has developed a plan. His team has been on site several times, and they're ready to go. So they took a barrier, and they found a way to remove that barrier.
Let's talk a little bit about the agency itself. Now, DBHDD, the Department of Behavioral Health and Developmental Disabilities, may win the award for longest title of a state agency, affectionately called DBHDD. But in all seriousness, its very definition combines two important issues: developmental disabilities and behavioral health. Let's start with developmental disabilities. And I want to talk about it from a practical standpoint and a long-term strategic standpoint. When you think about developmental disabilities, practically in the short term, what's top of mind on things you'd like to see accomplished? And then kind of what's a long-term strategic vision?
Well, the department, DBHDD, is responsible for the now and comp waivers, which is a Medicaid waiver for individuals who have serious intellectual and developmental disabilities. And we currently serve just over 13,000 individuals with one of those two waivers. We have another 7,000 plus they're on the planning list, so they'll eventually need waiver services. Some of those need waiver services today, but obviously we're restricted through budget for being able to add additional people onto the waiver. So I think one of the first things is really looking at how many people need that waiver today and how much funding is that going to require, and working with our partners in the General Assembly and the Governor's Office to get those dollars. The other challenge is, and probably the biggest challenge around that space today, is an adequate workforce. We just don't have that in the state of Georgia. One of the reasons our reimbursement rates are low. So the state, through the passage of House Bill 1013, directed the state to do some rate studies. DCH completed a behavioral health rate study. Our department conducted and completed a developmental disability rate study. Both of those are back. Both of those show that there's a significant increase needed in provider rates. Hopefully we'll see those funded in the upcoming session, and that'll be a game changer for the workforce. So short term, we got to right size the workforce. We got to increase reimbursement rates.
Now, the other part of the title is behavioral health. And I think it's important to separate that out. A lot of co-occurring stuff I know, and I'm a person who has survived behavioral health issues, but there's mental health and there's addiction. And a lot of time that work is complementary but separate. So let's talk about mental health for a minute. It impacts so many families and peers across the state. Talking about mental health, again, kind of what's going on in the immediate term, and what's your long-term vision for mental health?
Right. There's obviously a lot of challenges. A lot of people don't know that the department's primary function is to serve as a safety net for the system, which means people who have no payment source. They don't have private health insurance, they don't have Medicare, et cetera, then they fall into our safety net. The challenge, though, is again, goes back to workforce. Georgia just does not have enough providers, private providers. We are challenged to be able to hire enough clinicians and employees to work for us. So that's a huge challenge for us at the department, that we're creating creative ideas to overcome. Because at the end of the day, right-sizing the workforce is more than just about pay. There's a lot of other factors that go into that. I think the other thing that I have found from a department perspective is we have got to strengthen our regional offices. We have 6 regional offices around the state. We have staff in those regional offices, And we're going through a process now to strengthen that staff, strengthen those regional offices, empower them to make sure those services are being provided equally across the state of Georgia. And I'm excited about that. But there's a lot of progress being made around behavioral health, mental health, and we have a lot of work left to do, but I think we're starting to form a clear plan and a path forward, and I'm excited to see what the future holds.
And of course, the other side of that is addiction. There's three parts of the addiction family. There's prevention, treatment, and of course, recovery. And that, of course, they say there's 800,000 Georgians in recovery, and we say we lost 109,000 Americans to opioid overdoses. So clearly, addiction is an issue that impacts Georgia businesses, Georgia families, Georgia communities. Tell us what you can share about kind of what you're doing in the field of addiction.
Right. Yeah, the department's also the state's authority on addiction and substance abuse, and we have a very talented team that works on that every day. And one of the things we've really been focusing on recently has been the opioid epidemic, and obviously we're losing too many people to opioid and fentanyl overdoses. And the other thing that we're excited about is the fact that I've been named, and the department's been named as trustee for the opioid settlement funds. So we're in the process now of building out that network, getting a plan together. We anticipate in the spring of next year we'll start rolling out our first grant opportunities. But that's over a $600 million opportunity coming to the state, because between now and the next 18 years, we're going to have 600 plus million that's going to be rolled out across the state for all those things that you talked about. It's research, it's prevention, it's recovery and treatment, and recovery when we get someone through treatment. So we're excited about those opportunities.
Well, in your first year, I had some of my friends who work in the policy space or advocacy, and you've been to Mental Health Day and Addiction Recovery Awareness Day and Prevention Day and Harm Reduction Day. You have gotten out of this office and gone and met with families and people impacted by this. You've traveled, I know, to some of our recovery community organizations, ARSC's addiction recovery support places. And people know that. They see you there. I want to ask you, when not experts, but peers who have survived the disease, or family members who have lost someone to a mental health or addiction issue, or experiencing a developmental disability issue, what goes through your mind when you hear these real stories from real people in real communities?
Well, the department has done a good job of focusing on the peer network, building out a peer network, whether that's in the addictive disease side or the behavioral health side, adolescent side, forensic side. And one of the things that I have learned even more over the last 12 months is how important that peer voice is to have at the seat at the table in all decision making. And the department does a good job in that. We actually really lead the country in the peer program. So I think what's going to be important for us is to continue to strengthen that program, to continue to invest in that program. We obviously need more peers. We need more training. We need to fund more training slots for peers. And we also need to be concentrating on training peers who then are going to go to work in the field. We heard just a tremendous moving story at the Flame of Hope Award recognition last week about the lady who was homeless, was in crisis, was contemplating suicide, and then she went on a journey of healing and treatment because of the work that our DBHDD partners and our providers were able to provide her. Everything from the Georgia Housing Voucher, the supported employment program that we have. Now, not only is she living a life in recovery, but she's actually working full-time in a peer role, giving back. And not only is she in a peer role, she's going to be working as a forensic peer in the Lowndes County jail setting. So she's really going to be, already is, and it's going to continue to impact people's lives. And it was just a very moving story.
And, it's fair to say that DBHDD is the foundation for the peer movement, and that allows change to occur in communities all across the state. So we thank you and all the team members at DBHDD who work with peers. Let's talk a little bit about some of the other projects you've been working on. So House Bill 1013 was a transformational piece of legislation that impacted DBHDD. There's other legislation that will continue, but through that legislation has come down to some programs that DBHDD, you work very closely with sheriffs and do a lot of meetings with sheriffs on crisis intervention. And tell us a little bit, everybody knows about 1013, but how has that impacted some of the work that you and your team do at DBHDD?
Well, after House Bill 1013 passed, the late Speaker David Ralston said from the rostrum the day it passed, "Today hope won." So I think one of the things I have witnessed with the passage of House Bill 1013 is a renewed hope among providers, a new hope and restored hope among the DBHDD staff, and a restored hope among people who have mental illness and who are seeking treatment for that. And I think we're going to continue to see that because that created some momentum and a springboard for change in the system. And as a result of that, it led to the Behavioral Health Reform and Innovation Commission continuing to work. It has led to pilot programs around AOT, which is assisted outpatient treatment within the court system. It has led to jail in-reach pilots where we have a full-time jail in-reach coordinator and a full-time forensic peer in a jail setting helping connect people to resources. And it's led to the transportation study you're talking about, and the pilot with sheriffs, 30 sheriffs in Southwest Georgia. And it's continuing to inform our work as we move forward. So it's a really exciting time to be in this role. And it's a really exciting time really to be associated with DBHDD in general because we really are daily transforming this system.
Now, before we wrap this up, I want to talk a little bit about a couple of things. You've recently attended two ceremonies, one in Macon and one in Fulton County, with some groundbreaking ceremonies on two new facilities that are transformational. Tell us a little bit about some of the innovation going on and what these facilities are.
Yeah, we've recently broke ground in Macon, right in the heart of the city of Macon, on a Developmental Disability Crisis Center. It's the first in the state, and quite honestly, one of the first in the country. I've had other people who sit in my chair in other states who are commissioners in other states reach out to us and our team to talk about this project. But this is going to be a 16-bed inpatient developmental disability crisis center. So someone who has a developmental disability, they are stuck in an emergency room, it may be coupled with behavioral issues. We're able to take that person out of the emergency room, bring them to this facility, determine exactly what's going on. And it's not just the developmental disability challenges, it's also the whole health of the person. Integrated health care, psychiatric health care, physical health. We're going to be partnering with Mercer and Mercer Medical School. We're going to have students there and fellows and residents who are going to learn how to help take care of this population. Then we're also going to have a very robust outpatient clinic facility there to treat people who have intellectual and developmental disabilities, because so many of our doctors in communities do not have that specialized experience. And then we're going to have a very robust telehealth program there. So our doctors who are specialized and experts in this area will be able to telehealth with community doctors and help them. So that project is groundbreaking and is one of the first of its kind in the country, and is scheduled to open January of 25. So I'm extremely excited about that. It's actively under construction. And then here in the city of Atlanta in Fulton County, the state and Fulton County have partnered, and the state's going to fund ongoing operating costs of Fulton County's first behavioral health crisis center. We just completed a bed study to determine how many crisis beds do we need, how many crisis centers do we need. The bed study showed we need 8 additional crisis centers over the next 10 years. 5 of those are going to be right here in the Atlanta metro area. So we're building one in Fulton County in partnership with Fulton now. So it's just exciting to see the planning that's gone on for the last few years actually being implemented.
Exactly. And another issue that's taken a lot of your time the first year, and a lot of the team members at DBHDD, is your leadership role in the rollout of the 988 program. And I know that is a serious effort. Talk to us a little bit about what DBHDD DBHD is doing in relationship to 988.
Yeah. Well, for people who may not know, because we recently did a poll and only 16% of Georgians know what 988 is and actually understand what it is. 988 is a 3-digit number, national number. It can be called from any cell phone. It can be called from any landline. You can text 988, have a conversation with a licensed clinician who's specifically trained to be able to help people who may find themselves in crisis. People who could call 988 could be someone who is a parent of a child. It could be a law enforcement officer who's dealing with a situation that they need help. Or it could be someone self-calling, wanting to talk to someone who's contemplating suicide. Our call volume has continued to increase since it was initiated. It started July of last year in 2022. Georgia was a little ahead of the curve because they've had a 1-800 suicide crisis line since 2006. But we average about 20,000 calls per month into the 988 line. And so 988 is about having a place, someone to call, but it's also about having someone to respond. So the thing a lot of people don't realize about 988 is it is the easy button. It is the entry point into the mental health system. So if you need help, you call 988, and if it's determined that a mobile crisis team needs to come to you, we meet people where they are. So we'll dispatch a 2-person mobile crisis team. At least one of those members will be a licensed clinician. They will respond to the location where the person needs help. And it's also about having a safe place to go. So if the determination's made that the person needs to come into a crisis facility for a short-term stay to help them get stabilized, then it's about having good places for them to go all over the state. So that 988 system is going to take time to build out, but I would encourage you to remember that number, 988, and to feel free to utilize it anytime you need to. It's completely anonymous, and you can call 24 hours a day, 7 days a week. One of the things, too, is we're seeing a disproportionate number of calls coming from rural Georgia, and I think that's because they lack resources. And there's also more stigma associated with getting mental health services. The good thing about 988, no one has to know you even called.
You know, that reminds me, this wasn't something that I thought about until right now, but you went to the Sunbelt Expo and you and Commissioner Tyler Harper met with some farmers and you're working on faith and farming and mental health and addiction with the biggest industry in Georgia is agriculture and agribusiness. And you talked about how rural Georgia's responded. Tell us a little bit about why it's so important to make sure folks in rural Georgia know about these innovations that are happening and these new opportunities.
Well, on the agriculture side, and like you said, agriculture is the state's #1 industry, but we have a disproportionate number of individuals committing suicide who work in the agriculture industry. And from someone who has grown up in that field and who still is involved in that field, it is a type of stress that a lot of people really can't realize or understand, especially our generational farmers. They have such a burden on their back not to be the generation that loses the farm, loses the land, loses the heritage. So we need to be able to provide resources for the health and mental health of our agriculture community. And as we look at the call volume coming into 988 and we see more people calling from the rural areas, we know those people are reaching out and they need services. So we started the Faith and Farm Initiative. We had our first forum down in Moultrie at the Sunbelt Expo, but we're going to be holding those over the next several months all around the state. And we're taking the conversation where it matters, and that's to the farmers. And we're also going to be doing that with other industries. We're getting ready. The second highest group of suicide for the work class in Georgia is restaurant workers. So we're getting ready to announce a major rollout around 988 awareness for restaurant workers. And the #1 is construction workers. So we're looking at the data and we're making data-driven decisions.
Well, I think that's so important that not just you, but this team of 4,500 people is getting into communities and talking with real people who are experiencing these real challenges. Listen, we could talk all day. I know your time is limited. We've just heard from you about a bunch of serious issues that transformationally and directly impact people and families. But I hope you've had some fun this past year. So let's shift gears a little bit. I'm sure you've experienced some things you didn't know you'd experience. What are some of the things that have brought a little joy to you personally this past year? What's been a little bit of fun you've had this past year?
Well, just today, I was at our hospital in Atlanta celebrating Christmas with the employees, and just the excitement on their faces, and it was just a joyful, happy time to be there. Going to the Halloween events at our different hospitals, being down at our hospitals when they had an art contest and poetry reading contest, and seeing the patients and the staff interacting in such a positive, uplifting way. Meeting an individual who's in one of our hospitals who designs shoes and makes shoes out of paper, and it's just incredible at the level of talent that this individual has. So just getting out and meeting people and seeing our employees and our staff and our patients in our facilities. Every time, if I get burdened down here in this role sitting in Atlanta and I get frustrated, then all I've got to do is get out and go meet our staff, meet our patients where they are in our facilities, and I always walk away with a new renewed spirit, because they bring that to us. And I wish everyone could just see and witness the miracles that are being performed each and every day across the state of Georgia by not only our state hospitals, but all of our providers that are providing services to some of the most vulnerable citizens in the state.
We're going to wrap this up with two questions. And I have the great privilege of being one of those 4,500. And so what I want to ask you as we wrap this up, and I know I speak for the whole house at DBHDD, we congratulate you on a successful first year, and we thank you for leading with love and having a servant's heart. I think that matters to a lot of your team, maybe more than you know. But what I want to ask you is to kind of look at the camera and have a message for your teammates, your staff. What's your message to them 1 year into this?
Well, I knew coming into this that we had an incredible group of men and women working all across the state in the trenches, whether they work at central office, in one of our regional offices, in our forensic program, in our state hospital, wherever it is. I knew we had an incredible staff, but I have, over the last 12 months, got to know so many of you personally, and I have witnessed firsthand the miracles that you're performing each and every day to those that you serve, and you serve each of our patients with a servant's heart. So I want to let you know that I'll continue to be your biggest cheerleader. I'll continue to be the one standing there cheering you on and helping you remove barriers to being successful. I'll continue to go across the street from our office to the state capitol and rally support for things that will make your jobs and your lives more successful. So I just want to thank all of you for making the last 12 months so meaningful to me. I've had a lot of roles in the last 33 years in public service, but none compare to what I've been able to experience in the last 12 months. So look forward to a prosperous year in 2024. I think we're going to make tremendous progress as a team, and I'm excited for us all to get busy.
Commissioner, also there's one other group I'd like you to talk about and have you address, and that is those peers and families who you impact and your team impacts so much, and they're desperate for help. They're excited about the change they've seen. They've got all these emotions going on. So I'd like you to kind of look at the camera and talk to peers and families who are so hopeful about your leadership. And what will be your message to the people of Georgia?
Well, I know that it's a difficult system that we have. There's so many barriers to helping you. Workforce obviously is number one. But I want you to know that we hear you, we have heard you, we understand the flaws in the system. We know the work that needs to be done. It's not easy work, and the fixes won't occur overnight, but we are dedicated, I'm dedicated to staying on this path and on this journey to make sure that you get the resources and the services you need and that you deserve, so that Georgia will become the #1 state in the country for peers, the #1 in the state in the country for recovery, the #1 state in the country for people living with mental illness, and the #1 state in the country for people living with an intellectual and developmental disability to receive the services they need. But in order to do that, we're all going to have to be on this journey together. So thank you for what each of you do each and every day.
Commissioner Tanner, thank you, sir, for your service, for your leadership, and for who you are. You mean so much to so many in Georgia, and we just want to thank you for a successful first year, and we look forward to what's to come.
Thank you, Jeff.